going to start off and tell you a little bit about our new CureJM Center of Excellence. The director of the clinic is also here. He's speaking at another session at this moment, which is why I'm doing this one, but he's at the conference if you have further questions. So we started working on forming our center in December of 2017 officially, but there have been quite a bit of legwork that already went into the concept and starting to pull together the pieces that we wanted in the clinic. And that involved talking to some of our patients and finding out what they wanted, but then also talking with some of the other providers at Duke who already also had multidisciplinary clinics. And so we spent well over a year pulling together the resources and gathering ideas of how we could make the clinic function the best for the doctors and the patients and their families. We were recognized as a Center of Excellence in August of 2018. And so our center really focuses on having a multidisciplinary approach to both diagnostic evaluations and treatment. We focus on longitudinal and seamless multidisciplinary care. And that oftentimes looks like, for local patients, we'll oftentimes be their primary care providers for dermatomyositis. And for patients that travel, we often establish a relationship with their local rheumatologist. We work on transition of care. One of our pediatric rheumatologists at Duke is very interested in transitional issues and spends her research time studying those issues in other rheumatic conditions. And so we've had her involved from that standpoint in our clinic, and she's actually with Dr. DeVergsten right now speaking about that. We also have been previously involved in clinical trials. We do some translational studies too that I'll briefly touch on later. And then psychosocial aspects of support that's needed for juvenile dermatomyositis, and I'll talk a little bit more about that. And then training's the other component. I'm the first fellow who's primarily focused on, well, not only been in the center as in a clinical standpoint, but have also focused my research time on that. On JDM, and that's been with the support of CureJM, which I'm very grateful for. But we also have two other, so we have three other fellows right now at Duke, and two of them rotate through the center every time we have appointments with us. So I'm not the only one that's in that clinic. We have two more right now, and then we have another fellow starting next year who is, and by next year, I guess I mean July 1st, who's going to be rotating through that clinic as well. We see children at any stage of their disease, so we can be involved from the moment they're diagnosed until they're transitioned to adult care. Our team is headed up by Dr. DeVergsten, but at every visit, you'll see a physical therapist. We have a dedicated clinic nurse who also serves as the coordinator for the clinic. We have, we're really quite privileged to have a neuromuscular neurologist who works with us. So his interest is primarily in that interface of disease that happens between nerves and muscles. And he's done a lot of clinical trials. And so he's involved, especially at the diagnosis standpoint. And he's been really helpful because he can do things like core needle biopsies if needed, but he's really been instrumental in expanding the differential diagnoses that we consider, and we've actually caught quite a number of kids with very rare conditions because of his help. We work with GI, pulmonary, and metabolic geneticists because sometimes problems with metabolism can have some overlap with juvenile myositis and produce some of the same symptoms. And then we have a social worker who has been involved with our rheumatology clinic for over 20 years and helps us with those aspects in this clinic. And then we have other internal referrals that we can provide. We, for the most part, between Dr. DeVergsten and Dr. Reed, they've seen so much. So we've We haven't found that we frequently need dermatologists, but if there are issues that they want consultation on, that can easily be provided. And then the other area that we've started doing more work with is with our pediatric plastic surgeons in doing things like removing focal lesions of calcinosis that are somehow functionally impairing a child. So we've sent people that had really bad calcinosis on their fingertips or even up and down their fingers, and they were having a hard time picking things up, doing buttons to get dressed. And then we've had other children who have really bad calcinosis on their bottom, and they basically can't sit in school because it hurts so much. And we've been able to remove those with the help of our plastic surgeon colleagues, and they've been, we've had some quite good results. And then, as I started to say, we provide care for all ages of children up until 18. If somebody comes to us that's over the age of 18, they'd see our adult colleagues. And then our model has mostly been, as I hinted, either for local people, they see us typically as their primary rheumatologist. But then even kids that live elsewhere in North Carolina, it's a big state, so we partner with the rheumatologist in Charlotte, and sometimes they'll send their kids over for a visit 1 or 2 times a year just to make sure we don't have any additional ideas in their care. And then there are other situations where people get on a plane for a visit once or twice a year, or they come out for one specific problem that they just, seems to be plaguing them over the long term to see if we have any additional ideas in their care. So a lot of the questions that we get consults for are things like JDM mimickers. So a child comes in, they get a diagnosis, they get started on some kind of treatment, and they're not having a response as expected, or they come in and they have what kind of looks like JDM, but they also have some weird features to it or some atypical features. Kids that have ongoing disease activity despite treatment, and then disease complications, as I've talked a little bit about. And then the other thing we've seen is people with medication side effects, and maybe their local rheumatologist tried switching their medicine once or twice, and they're running out of options that they're more familiar with in JDM, and so sometimes we'll help navigate that as well. As I said, Dr. Vergston is the center director. Dr. Ann Reed is heavily involved. She's also the chair of pediatrics here. And so she sees patients in clinic, but Dr. Vergston handles the majority of the day-to-day operations because she's so busy being chair. But we are thankful to have their expertise, or both their expertise as rheumatologists that have been doing this for a long time. Dr. Edward Smith is our neuromuscular neurologist that I talked about before. Myself, so I'm a fellow now, but my fellowship is done at the end of next week, so I'll be transitioning as an attending in this clinic. Dr. Ardalan is, we're very fortunate to have him coming and offering a new flavor to our clinic in October. We're very excited about. Sylvia Siki is our nurse, who is the nurse both at the visits and then she helps coordinate visits. Rebecca Quinones is our primary physical therapist, and then Kalisha Fleming is our research coordinator. We do research, and we offer that opportunity to all our patients. Most of our research studies are along the same flavor of things that you're hearing here. So it's a lot of asking people questions that we document on paper. And then we also do translational research, which means that it's research that usually requires some kind of specimen. But the majority of our specimens, actually right now, all our specimens are just added on to a blood draw that's already going to happen to monitor their disease or their medications and make sure they're not having side effects. And then some of our current research areas of interest are some of the metabolic changes in juvenile dermatomyositis. And Dr. Vergston presented some of his findings from a metabolomic screening study he did at GCOM this year, where they found that a certain metabolite was elevated in juvenile dermatomyositis that we did not see in healthy children. I do gene expression work, and my particular interest is in trying to determine associations or biomarkers that have associations with treatment response. So the major question I'm hoping to answer is, can we figure out who's going to respond to medicine before we start them on that medicine? And then we have other people that partner with us. There's an adult rheumatologist who's really interested in the mitochondrial disease aspects of dermatomyositis. And so his lab, he's a very senior person who's been doing research in myositis and lupus for over 30 years now. And so we have his expertise as well. And then patient-reported outcomes once Dr. Ardalan arrives. So in general, or in summary, we provide care across the age spectrum. We can help in many ways, whether it's being the primary rheumatologist or just coming for a one-time consultation. And I think as you're going to hear about most of the CureJam centers of excellence, it's a team environment. So there are multiple people thinking about your child and bringing their expertise to that decision-making process on what to do next, and really trying to help them. So I think we're really fortunate to have the resources that we do and the support, because we're able to bring that to every patient visit. And this is our direct phone number. If you know anybody that is looking for some kind of support in some way, we'd love to help out.